My pathology is Barrett's esophagus. My patient would present with symptoms of GERD and dysphagia. First, I would identify my patient with 2 patient identifiers. I would get a good history, have the patient remove their clothes and put a gown on, and make sure about pregnancy and ask about their last menstrual period. I'm going to do 2 projections. The first one will be a PA for upper GI. First, you're going to want a 10 by 12 lengthwise cassette with your left marker because their PA, the left is going to be near you. You're going to put that in just like an inch in on the image receptor. You need transverse detent and lined up to your image receptor. You want 40 inches to your image receptor. That's good. And then you also want your patient to be prone and make sure that there's no rotation by checking their hips, and make sure that they're lined up straight on the table. First, we're going to find the vertebrae of the spine, and you're going to go 1 inch left of the spine, and then you're going to find the lower rib margin and go 1 to 2 inches up from that. So right about there. And you want your collimation to be 10 by 12. And then you're going to put your shield on them as much as possible outside of your light field. And then we'll measure. You need to measure through the central ray. She is 15 centimeters. If you have a hypersthenic patient, you should center up another 2 inches, and if you have an asthenic patient, you want to center down about 2 inches. And then we will shut the door before leaving the room. Okay, so she measured 15 centimeters, so you're going to find 15 centimeters on the barium exams chart in your exposure charts. The KVP is going to be 95, and the mass will be 5, and you need a large focal spot and table Bucky. Your exposure is going to be greater because of the barium in the patient. Before you take your exposure, you're going to instruct your patient to take a breath in, blow it out, and hold it out. The next projection I'm going to do is the right lateral. The first thing you're going to do, the first thing you need is a 10 by 12 lengthwise, just like last time. And you're going to put your right marker in a little bit further than last time because you're going to collimate down. You want your patient in a right lateral position, checking their scapula to be perpendicular to the IR, their posterior ribs to be superimposed, and their hips to be superimposed. So she looks good. Then you're going to find the lower rib margin, and you're going to go up about 1 inch. That looks good there. And then the mid-coronal plane is from the shoulder to the hip. So you're going to go halfway between the mid-coronal plane and the anterior abdomen. So right about there. And then you're going to have a lot of light on the table. So you're going to collimate down. Right about there. That looks good. And you still want transverse detent and lined up to your Bucky. And then shield as much as possible outside of the light field. You're going to measure, and she is 25 centimeters. And we'll shut the door before we leave the room. So the exposure factor is based on her 25 centimeter measurement will be 95 kV and 22 mass, and large focal spot and table Bucky again. And we'll tell her to take a breath in, blow it out, and hold it out.